TRT and Hormone Optimization Group. Good evening. This is Justin again, and I'm building on to the previous video I did in which I talked about the basic background of CJC-1295. Today, I'm answering some questions I've been getting since that previous video, such as what's the typical dose, why should I take it on empty belly, what are some possible side effects, how should I store the drug.
TRT and Hormone Optimization channel. I was on the channel before, so I've been following the channel, watching it every now and then, so be sure to check them out.
Consider subscribing, hit that notification bell, and you'll be on your way.
So to start off, the typical dose is 100 micrograms, and the reason being is because pituitary saturation tends to occur around 100 micrograms. Even in doses beyond 100 micrograms, they don't really tend to yield a whole lot more relevant GH spike beyond 100 micrograms. So therefore, if you're dosing 100 micrograms, you're getting pretty much most of the bang for your buck, and you're not wasting excessive drug by adding more to the mix, which will yield very little, if anything at all. So next question was, can I dose it once a day or dose it twice a day? I recommend typically that patients start off dosing it once a day to assess tolerance, and do that for first month or so to see how they tolerate the drug. If they handle it quite well, then you can proceed to twice a day if you'd like. Possible side effects: flushing. That's one of the most common ones I see. Water retention, which tends to be transient and typically subsides in the first month or two. With that being said, also water retention can compress some of the nerves, and that's why sometimes people say they have what's a carpal tunnel-like syndrome. And once again, that's due to possible water retention compressing on your nerves. Vivid dreams is another one that I've had a handful of patients tell me about. Next one was, if I can remember correctly, what constitutes an empty stomach? Well, you have to take into consideration that gastric emptying has a delayed response of about 20 minutes after you eat. And peak gastric emptying occurs around 120 minutes after you eat. Even in patients that have gastroparesis, which is a condition in which their gut essentially doesn't empty accordingly or empty like it should, those patients tend to have about a 10% retention at the 2-hour mark. So I would say for most folks, roughly give it at least an hour and a half, 2 hours before you start dosing the drug. Next question was, how do I store the drug? That's a simple one to answer. Store it in the fridge, pull it out when it's time to use it, and put it back when you're done with it. And the last question I got was, why should I have interruptions in the dose administration? And by interruptions, it means, why should I do 5 days out of 7 days? Or why do some providers tell me to do 3 months on, 1 month off, 6 months on, 1 month off? It's speculated that people can develop antibodies to the drug. Also, that's to avoid what we call tachyphylaxis. Tachyphylaxis is just a nice medical word for saying drug don't work no more. Okay, thanks guys. Thanks for tuning in, and if y'all have more questions, shoot them to me. I'll try to answer them in a video. Thanks.
Alright guys, well, do this next. Click on one of these thumbnails to learn a ton more about TRT and hormone optimization. Thanks.